The following podcast is brought to you by the Crime Prevention 101 Safety Store, your one-stop shop for personal safety. Come by and browse at crimeprevention101.com.
Welcome to Crime Prevention 101, the podcast with an optimistic perspective on a sober subject. The views and ideas expressed on this program are strictly those of the guests and do not necessarily reflect the views and ideas held by the host, associate participants, or sponsors. Now, here's your host, Crime Prevention Specialist Susan Bartelstone.
OMG. Got a few quotes for you. EMDR transformed my life. It is the most effective form of therapy I have ever tried. And that's coming from someone who's tried just about everything. Talk therapy, cognitive behavioral therapy, dialectical behavioral therapy, mindfulness, decluttering, float therapy, and various medications, to name a few. And this quote came from a blog by C. Daniels. It was from July of 2019. Second quote, by the end of each session, the memory I had focused on had gone from being highly charged to being somewhat neutral, like a scene playing out on a screen, but disconnected from my emotional responses. And this quote is from a blog by N. Olah, O-L-A-H, and this was in July of 2020. Now, these are just a few quotes from some of the patients of eye movement desensitization and reprocessing, which is simply known as EMDR. And I looked up a dozen similar quotes. Patients who were suffering from anxiety, substance abuse, panic attacks, of course, PTSD, post-traumatic stress disorder, like we were talking about, crimes like rape, childhood traumas, sexual, marital, and family problems, and a whole host of other traumas. This is Susan Bartelstone. As always, say hi to my partner in crime prevention, Lydia Perez.
Hey, everyone. Welcome to the podcast.
Yep, Lydia's our tech whiz. Can't do it without her.
All right, then. So as we mentioned in our previous show, the last few podcasts dealt with darker topics: dating cautious, scams, date rape drugs. So we thought it was time to do some healing here in the Universal Dojo.
Yep. And as you just heard, we've been talking about an innovative, powerful, and scientifically proven method called EMDR that achieves healing results much, much faster than traditional therapy modalities.
Yes, and apparently, as I understand it, it's been endorsed by the American Psychiatric Association, the World Health Organization, and the U.S. Department of Veterans Affairs, the Department of Health and Social Care, and the Substance Abuse and Mental Health Administration, among others.
Now, last podcast, we revisited an interview from my former Crime Prevention 101 radio show with Dr. William Zangwill, who is one of the foremost practitioners and trainers of EMDR. And let me just review some of his credentials with you. He's been a licensed clinical psychologist and EMDR practitioner since 1990. He's physically located in New York City. He was in the first group of people trained to train other therapists in EMDR, and he worked with Dr. Francine Shapiro, who is the originator of EMDR. And he's since trained thousands of therapists all over the U.S. and abroad. And this is all through the EMDR Institute. And he has written extensively on sexual victimization and on combining EMDR with other innovative therapies and non-traditional modalities, particularly meditation. Now, it was a long interview that I did with him originally on the radio show, so we broke it into two parts. Today's podcast is part 2 of that interview.
That's right. Today's podcast features who is and is not an appropriate candidate for EMDR therapy, how to find an EMDR practitioner in your area, and the powerful combination of EMDR therapy with meditation. And if you didn't listen to part 1, Susan and I strongly suggest you do so before you even listen to part 2, as it may be somewhat confusing otherwise.
Right. All right, let's take a quick break for an important message. Be sure to stick around because, as always, we got some practical tips for you at the end of the show.
You're listening to Crime Prevention 101 with Susan Bartelstone. Susan would like to remind you that no absolutes exist in a crime scenario, and no advice can possibly address every variable. Each situation should be evaluated individually and responded to in the way you instinctively judge best. It's Susan's aim on this podcast to provide you with the information and options that will help you make that instinctive assessment quickly and safely. However, sometimes nothing can be done to prevent a bad outcome. And if you're already a survivor of the kind of crime we're talking about on the show today, or any other crime for that matter, please remember that there are no right or wrong responses in a criminal encounter, and nothing that happened to you was your fault. Even if you think you used bad judgment in the situation and left yourself vulnerable, that's never an excuse for a crime or violence. So please, call yourself a survivor and not a victim. And understand that with time, distance, and the proper professional help, you can put what happened into perspective and get on with your life. Now, back to Crime Prevention 101.
Now, let's go to my previously recorded interview with Dr. William Zangwill about EMDR therapy technique.
And if you're a survivor of any kind of crime, violence, or trauma, if you know or are living with someone who is a survivor, or if you yourself treat survivors in clinical practice, you'll definitely want to hear this important and uplifting show.
And welcome back, everybody, to Crime Prevention 101. And I'm here talking with Dr. William Zangwill about EMDR therapy. Now, William, let's talk a little bit about who is and who is not appropriate for EMDR therapy.
Sure. Let me answer that. Let me talk about who's not appropriate.
Okay.
What EMDR does therapeutically, it's like stepping on the gas, and you go faster most of the time. But if you've got people who are already it feels like hanging on the side of the cliff by their fingernails, what they may need is actually to go more slowly. Mm-hmm. Now, there are aspects of EMDR and there are there are different ways of implementing EMDR that can adjust to that. But for people, for example, who are doing self-injurious behaviors, who are cutting themselves, mm-hmm. Who are suicidal, basically, as I said, who are sort of hanging on to the side of the cliff by their fingernails, EMDR can be overwhelming at times.
Okay.
For people who have a current severe substance abuse problem, many of them have a trauma background and could definitely benefit from EMDR. But oftentimes what happens is for those who use substances to numb themselves, what EMDR does so powerfully is to bring things into our awareness. That's one of the reasons we think it works. So if someone is, actively using substances, they're somewhat out of control, going through the trauma treatment can actually increase the urge to use because it brings up, temporarily more pain, more awareness. And the last group that I would hesitate with, people who are psychotic, people who are, hallucinate and so on, you would not want to do it with. And the last group is if you've got people in the legal system, they need to, be concerned about, actually the next to last group, be concerned about would this affect their case, would it affect their testimony and so on. So they would need to check with their legal representatives, in terms of would this disqualify them, would it affect their credibility as a witness and so on. The other group are people who might have some medical problems. If you've got an 80-year-old person who has a history of heart, disease, you may not want to relive a trauma when they were 5 that would get their whole body, their heart accelerating and everything else. Oh, because
that can happen?
Oh, absolutely. No, Susan, one of the most fascinating things about this is that when you bring up these painful memories, and you stimulate the material effectively, people oftentimes can feel as if they're experiencing it again. And the value is you take them through it and take them safely through the other side so they can feel, on a heart level, on a gut level, that they're safe. But while it's happening, I've seen, people will sweat, they'll turn red, they'll talk about their heart racing. I've had people tell me that when we dealt with some memories of physical abuse, for example, the area of their thigh where they may have been hit by a belt started tingling. So if you've got someone, if you've got somebody in the early stages of pregnancy, for example, where a lot of fetal development is controlled hormonally, if you've got somebody, as I said, who has had some heart problems, it doesn't mean you shouldn't do EMDR, but you want to make sure you take good care of your client and, check with their doctor and make sure it's a safe procedure for them.
So it's really important that that the people that are doing this work have a clinical background, would you say?
Yes.
So that they can...
We only train people who are licensed clinicians.
I see. Great.
Dr. Shapiro, to her credit, when this was, just coming out and people were incredibly excited about it, there were people calling all over who wanted to do this as a technique. And her concern then and her concern has always been making sure that we protect our clients, our patients, and that only people who can look at the person as a whole, not just as somebody who had a trauma, are using this.
Excellent point, yes. Because I can see it could stir up a whole hornet's nest of stuff if you don't know what you're really dealing with.
You're absolutely right.
Now, do you also treat secondary victims of, if you're dealing with just let's say an assault or crime trauma, do you deal with the husband and the wife? Because I know you talked about family therapy in your practice.
Sure.
Does this figure in, and would this be recommended because as you know, and I hope those out there listening might know, there's not just one survivor of a crime. Everybody that's around that person, that's in an intimate relationship with that person, is now also a survivor.
No, absolutely. In fact, sometimes it stirs up more for them than the actual victim. So any good clinician is going to do a thorough assessment, and EMDR has been very, very helpful for situations that are called vicarious traumatization.
That's the word. I knew there was a word for that.
I hope it doesn't sound too jargony, but it really accurately describes what happens. Sometimes just by witnessing, what or hearing what people have gone through. For your more sensitive people, that alone can be enough to really be somewhat disorienting and very, very painful, or what it portended. Sometimes a person was in an accident, they survived, but yet the loved one realizes how close they came to losing them and can start developing some obsessional thinking or some intrusive thoughts, repeated nightmares, and so on. So what I talk to people about is EMDR is good basically in two areas. One, where people have been through specific trauma, such as you delineated earlier. And the second area is where there's a discrepancy between what you know intellectually versus what you feel. And I think most of us, when I'm training people, I'll often ask the group to raise, to have people raise their hands who've ever been attracted to someone they shouldn't have been attracted to.
My hand is up. Okay.
Unfortunately, Susan,
Two hands are up.
So is mine. And the reason that happens to us...
I bet Harry Potter, my faithful engineer's hands are up.
Probably both hands in Harry's case.
Both hands.
But the reason that happens is not because we have a self-defeating personality disorder or that we're masochistic. But as I mentioned earlier, we literally, again, emotionally process material in a different part of the brain than we do intellectually. So we can have very strong beliefs, very strong ideas of who we should be with or what we should do and so on, and not really have control over whom we're drawn to. So EMDR is incredibly helpful where that discrepancy exists. The person who was abused as a child and yet blames themselves. Because I should have told someone. They were 5 years old. They had a parent who was not even, was purposely not noticing what was going on and so on, but years later they're still blaming themselves. That's an example of what I mean by that discrepancy between what they know intellectually. They've read the books, they've watched Oprah, but they're still stuck emotionally.
Exactly right. They haven't fully gotten all those buried things up there to process.
And haven't been able to accept themselves for who they are. So that's another area, you would not call trauma necessarily, but where EMDR has been incredibly helpful.
And I want to really emphasize this, that there are secondary survivors and victims to any kind of traumatic incident that happens. If it happens to someone that you are intimately involved with, you're affected by it. And you really need to be on the alert for some of these symptoms of PTSD yourself. And, so I was talking with a friend about the show coming up, and she was saying, she's a mental health worker, and she said she is getting burned out dealing with other people's traumas. And I think that she would be, I said, I think you're probably going to be a good candidate for this. You probably would just need a couple of sessions to get at this stuff. And, family members who, again, assault or murder or suicide victims, or those people that discover someone who was murdered or committed suicide. Someone wrote me a letter about that, an email. Emergency service personnel. You were talking about working with people that were, I guess, first responders at the 9/11 tragedy. Emergency service personnel, police officers, any first responder who day after day witnesses trauma after trauma. These symptoms could be accumulating in there and can cause, I guess, a lot of maybe self-destructive or, behavior that could be dealt with EMDR.
Susan, you're absolutely right. In fact, years ago, a colleague of mine who was head of the EMS in New York, head of the mental health division, and she had done a study with some colleagues, and they found that with the first responders and the emergency service personnel, it was only a matter of time until the stress of their job, the horrific things they had to see and deal with, affected them. Even the strongest person, if you put them in that situation repeatedly, for some it was after a few years, for some it was more, but for almost every single person they looked at, to be in that situation time after time after time, it affects us. And so you're absolutely right.
So I'm really hoping that maybe some of the people out there that are listening to this that have the ability to consider this option, if you're working in that area, take heart on this. This is really important to recognize before you do get burnt out, like my friend was telling me.
That's a good point.
Now, I also want to talk to you. In your bio, it mentions that you combine EMDR therapy with meditation.
Right.
Now, would you talk a little bit about how that works?
EMDR is incredibly helpful at dealing with specific aspects of trauma. I had a rape victim a while ago who had been raped 12 years before by a stranger, hid in her closet, came out, and 12 years later she could still feel the pressure of the duct tape he had put over her eyes. And she was this amazingly open woman. We did some very powerful work, and because of her strength and her openness, in a very few sessions, she reported, she said she couldn't feel the tape anymore. She could not feel it because we had processed that emotional pain.
Oh, that's outstanding.
I'm sorry?
That's outstanding.
No, it was just, and again, it was mostly due to her and the process. But what it didn't deal with her was, why did this happen? And what I found, what I find in using mindfulness is that it does two things. It helps the person to more deeply look at what this is stirring up for them, and especially most mindful practice has a built-in component of acceptance. I'm not a Buddhist, but there's a wonderful message, the Buddha said was one of the most painful, or one of the most important causes of suffering is people wishing things to be different than they are. So in our mindfulness work, one of the things I do is basically look at, unfortunately things happen in life sometimes, and people find it oftentimes very comforting.
I understand. All right, hold that thought, William. We're going to take another break. We're going to come back. I want to talk about vulnerability and blaming yourself for what happened. So stay tuned.
Now back to Crime Prevention 101 with Susan Bartelstone.
And welcome back, everybody. And we're talking to Dr. William Zangwill about this amazing innovation in therapy, EMDR. And we spoke earlier that, William, with victims of violence, and especially if it's of a sexual nature, you're concerned with two issues: vulnerability that the survivor feels, and guilt and shame. Just a few comments on that, if you will.
Okay. The vulnerability is, the most common aspect that people focus on, because people's assumptions that the world is safe, that I am safe, that people won't do horrible things, literally gets shattered. That's a perfect target for EMDR, and people usually respond very quickly. A more pernicious result of traumatic experiences oftentimes is the person blaming themselves, either for what they did or for what they didn't do. I had a client one time who had been traveling abroad and was jumped by three men and, assaulted and robbed. And there was a part of him that felt like some superhero, he should have been able to fight them off. And this showed what a weak person he was. I've had people, and especially when there's been long-term sexual assault by a family member, by a relative, people often feel a tremendous amount of shame and guilt. And it's something that's very important that's, to be worked on. It's an aspect of EMDR that is highly stressed. But honestly, it's harder. It is harder because people often have these deeply held beliefs that, I'm tarnished, there was something wrong with me. Because being that we're human, and this is, a very difficult thing for people, is that in these situations, people can feel sexual pleasure, for example. People can respond, and we know that that's because of how the body is wired. Infants at birth can respond to stimulation. All the wiring is there. But people see that as a result, and sometimes this is imposed on them by their assailant. See, you're responding. See, your body is responding. This must mean deep down this is something you really want. And people will carry that message and use that to beat themselves up.
I am so glad you mentioned this because this is very little discussed and critically important.
I agree.
What? I don't hear it mentioned almost nowhere, and so I'm just thrilled that this point came up. One of the things that I always say on every show, and I don't know if you know that I'm in addition to being a crime prevention lecturer, I was also a self-defense instructor for many years, and people would come to me, I've heard these stories forever, and I always tell people, and I always mention in the show that for any survivors out there, especially if you're a survivor of the kind of crime that I'm talking about, please understand that nothing that happened to you was your fault. Even if you think you used bad judgment and put yourself in a situation where you became vulnerable, that is not a justification for a crime. And that the fault is always on the person that committed the crime. But it's one thing, as you said, to know it, to hear it, and right. Another thing to believe it. And especially if you did have that reaction, you're gonna that guilt and shame is going to be very difficult to get at. And I'm really thrilled that.
Well, pardon me for interrupting, but one of the important aspects of EMDR is that when we have people go down, we always ask them how they're labeling themselves in a negative way, because people always do. I'm helpless, I'm vulnerable, I'm defective, I'm damaged goods, whatever it may be. But part of the program, part of the EMDR protocol is designed to ask them, so even though this happened, what would you like to believe about yourself? And the way I phrase it, and the people I work with and train and supervise, is what we're looking to do always is help the client to judge themselves more fairly. And by that, we have said, great, so even though this happened, what would you like to believe about yourself now, moving forward and not, hopefully helping them be less stuck in the past?
Excellent. Fantastic, insight into this, and I really love the framework that you put the EMDR therapy in. I know you have to go off to your conference. Is there any final thought, the final thing that you'd like to say to the audience before you go?
Susan, just thank you for this opportunity. It really, again, not to overpromise it, nothing works for everybody, but this is incredibly helpful for most people. And so if you're recognizing yourself or someone you care about in this situation, I strongly encourage people to give it a try, but just make sure they give it to somebody who's been well trained.
Well, I'm going to make sure I give lots of resources where people can find an EMDR practitioner.
Great.
And I'm going to let you go to your conference, and thank you so much for being on Crime Prevention 101.
Susan, I enjoyed it. Thank you so much.
Okay, we're back. So don't forget You can follow the show on Facebook, LinkedIn, and Instagram. And if you enjoyed today's podcast, click that subscribe button and hit that notification bell so you don't miss the next episode drop. Be sure to check out the crimeprevention101.com website for safety tips and resources. And while you're there, get Susan's free safety guide, Keeping Yourself Safe, All-Time Top Tips. It's a terrific guide with tons of tips, probably some you've never seen before. And you can also DM Susan with questions you may have about your own personal safety issues on any of our social media channels, or you can go old school and just email her at solutions@crimeprevention101.com.
That's right, Lydia. Now, again, for any survivors who might want to try EMDR therapy or more traditional forms of therapy, it's just important to find the right type of therapy to try and help you. And healing is a process, often long and difficult. And for some folks, it's going to be impossible without some kind of therapeutic intervention. Lydia, let's go over these tips. We gave them out last show. Let's give them out again. How do you choose a therapist?
Yes, definitely. So, number 1, interview at least 2, maybe even 3 therapists and choose the one you feel fits you best before you make a commitment to therapy. During the assessment interview, confirm what area the therapist specializes in. And if there are any areas that they're uncomfortable with, such as religion or LGBT issues, for example, you may want to reconsider that one. You want to make sure, if you opt for a traditional therapy modality, that the therapist specializes in or is experienced in dealing with crime survivors, rape, sexual assault, child abuse, domestic violence, etc. Not all are. And this could really set you back. So if you feel the therapy just isn't working for you, or you aren't getting anywhere after a reasonable trial period, or you feel you aren't getting along with the therapist the way you thought, don't hesitate to stop and find another therapist. The important thing is that you just don't stop therapy.
Right. And you know what I decided? I'm going to put this up as a tip sheet, put it in the safety tips page on the Crime Prevention 101 website. Check for it under the rape and sexual assault tab, how to choose a therapist. I think I should do that, right, Lydia?
Oh my God, that would be great. Yes, of course.
Now, before we go, Lydia, let's revisit the item that we talked about in the last podcast. I'm going to go into a little bit more detail. There was a 41-year-old transit worker. His name was Maurice Park. This was back in 2009. He'd been attacked and mugged and stabbed 7 times. He was stabbed it was three people mugged him and attacked him and stabbed 7 times. And he was coming home from his shift, working at the transit. He ended up killing. He was a martial artist. He was highly trained. That was why he survived that attack. Mm-hmm. And he was looking for the people that did it to him. They had ran away. He ended up coming upon a man who had been on the scene but had been trying to help him. A good Samaritan. He didn't realize that because he was in the middle of battle, so to speak. He didn't realize this guy was an innocent bystander who was trying to help him. And he ended up killing this man. Now, the reason I included it in the last podcast, it had been part of my original interview on the old radio show that I did, was because New York City's current mayor, Eric Adams, was then a New York State senator, and he championed Mr. Park's cause. He felt that there were mitigating factors to this murder, as do I. And at that time, he was sponsoring a bill that would take into account any mitigating factors in a situation like this one. I couldn't find out if that bill had passed. But I have a quote, the murdered victim's mother, at the end of the trial. This is a direct quote. She said, "No one wins in this courtroom today. We are both losers." He was sentenced to 15 to life.
Wow.
And she said, no one wins. Now, talk about gray areas. I mean, someone traumatized by an attack, wounded in the attack, not thinking clearly, acting under fear and duress and distress, making erroneous assumption, convicted of murder seconds, sentenced to 15 years, which is the most lenient that he could get up to life. And he was eligible in parole in 12 years. However, he is still there. He's in the Clinton Correctional Facility. And I don't know if he's going to be coming up for parole. I hope so. He could be there for a long, long time.
Wow. I agree. This definitely isn't black or white. It's a very unfortunate situation.
Yeah, I'm guessing that Mayor Adams, then Senator Adams' bill did not pass. But anyway, let's give some resources again where people can go to find an EMD practitioner. And if you're a therapist out there and you want to inquire about getting EMD training for yourself, let's give some resources for people.
Definitely. The contact information for Dr. William Zangwill here in New York City is 212-663-2989. Also, check out his websites. Tons of articles there about EMDR and the EMDR meditation connection. The websites are emdrandtraining.com and emdrandmeditation.com. If you're trying to find an EMDR therapist or get EMDR training to enhance your practice, then visit emdrmeditation.com, the EMDR Institute, which is emdr.com, and EMDR International Association, emdria.org. As Susan mentioned, also on our Crime Prevention 101 website, under the Rape Sexual Assault tab, we have some safety tips for you that you can access. Surviving Rape, Myths and Facts, Surviving Rape, The Road to Recovery, and the accompanying The Road to Recovery Life After Trauma Healing Journal, which is coming to the Crime Prevention 101 safety store soon.
Yes, and by the way, all the safety tips are free. You can download as many as you want. Keep checking the site if you're interested in safety tips, because I keep adding content all the time. Now, starting to wrap things up, I agree with Dr. Zangwill, Lydia. Most people are going to need more than one healing modality to help them put what happened into perspective and get on with their life, right?
Yeah, 100%. It's never more than one. I mean, it's more than one.
It shouldn't be more than one. I don't think one's going to be enough.
No, I agree. So the last podcast and this podcast will be the first in a series of shows on non-traditional methods for healing from the debilitating consequences of crime, violence, physical or emotional abuse, or trauma for that matter.
Yes, and over the course of the coming year, we're going to do more shows healing with alternative therapy modalities like EMDR. Hopefully, we're going to bring you some modalities you are not familiar with. We're going to talk more about healing with self-defense, healing through creativity in the arts, healing by helping other people, and as many as I can find to highlight. Please continue to send me your comments about the show. Well, it's so gratifying. Lydia and I are both so thrilled when we get this kind of input from people. We want to continue to present topics and resources that will be meaningful to your safety and your quality of life. So until we meet again, as we say here in the Universal Dojo, it'd be a crime not to listen.
So stay tuned and stay safe.